Dr. Jacqueline Rabito here with Let's Move Physical Therapy, going over some of the specific interventions that we apply here. This list is not exhaustive, as I probably can't remember everything perfectly, but some of the big highlights I'll go into for you. The big one is hippotherapy. So that's physical therapy being performed on the patient while they are on the horse. And we are doing different strengthening, balance, vestibular, range of motion activities for the patient while they're on the horse or out there walking with the horse. We do a lot of gait training or walking while you're on the horse, but also while you're walking with the horse to challenge your gait speed, stride length, stride variation on gravel, sand, smooth surfaces. And so that's one of the interventions that we do have here. And as you've seen on the other videos, you got a tour of the clinic and a tour of the backyard too. So just remember when you come in for your evaluation that we always do the evaluation in the clinic. We do not just go straight away in the backyard. So I did want to highlight that. Another intervention that we apply is the application of Kinesio Tape or other taping techniques here. Myself, I was a student athletic trainer while I was in college, and my assistant has taken all of the taping certifications as well. And so we do love and like the use of tape here as well. So that's something else that we can offer to you. Another intervention that we have is traction for the cervical spine or your neck. And so we have that machine in the back. Another intervention that we also have is like the low laser diathermy, which is also offered to help with inflammation. And it's just a red laser. If you want to know more about that, just ask me about it because that can get very specific and very complicated. Other techniques that we use are NDT or Neurodevelopmental Treatment techniques. You'll see us use this with a lot of babies. So that's us moving through all the gross motor skills that are needed. So rolling, half kneels, crawling, and you'll see our hands on the kids or not, depending on where they are with the skill to help facilitate performing those with correct body mechanics. And two, we also do that with some adults that have more neuro issues in nature, and we might bring you back a little bit to do some crawling. So please don't be surprised if we start to ask you to do stuff on your hands and knees. Other interventions that we have here are stretching, and that can be of any joint. And oftentimes we'll give that to you as homework to perform on your own. And then strengthening, balance activities, vestibular input activities, which you may see on a ball or a different surface or on the horse as well. That is also incorporated there. Gait training, so using the treadmill, we have the steps in the front here, the ramp. We also have steps out in the back, in the horse area too for gait training. And then trying to think of anything else that we are able to offer here. We do also ice massage if there's like a specific acute area, especially with ankle sprains. We'll do ice massage with that. We do a lot of manual or myofascial release techniques as well to help your joint to feel better with pressure in different directions, and then moving the muscles in different ways or the fascial layer in different ways to help relieve pain. And then another big intervention that we also apply is called craniosacral therapy, which I won't get into too much detail about it because it can also be very complicated. But the gist is we'll be feeling the different rhythms within your body and trying to adjust and do different releases at the different points. And we do follow the 10-step protocol here. Of course, it depends on your situation and what parts of the protocol we need to and need to not apply. But we do also provide that here as well. And I'm sure there are more that I've just forgotten. Trying to think. Oh, we also do cardiopulmonary rehab to a certain extent, as we will monitor your oxygen and heart rate, blood pressure if needed when doing exercises, or we'll monitor it after each activity. If you're on oxygen or medications that are really controlling of the heart and lung systems, we do take that very seriously, and we do monitor that very intensely as well. So then you have data of what's going on, and then you can provide that to your doctor also.